Welcome and welcome back to my channel. My name is Tawanda and this is Nursing, Lifestyle, and Money according to Tawanda. Today, ladies and gentlemen, we got to talk. I will be spilling the tea, literally, on all things nursing lawsuits. Okay? I have been a nurse for a significant amount of time. I spent a huge amount of that time being a nurse manager, okay? Whether I was a shift supervisor, a unit or clinical manager, and I spent a very significant amount of time as an assistant director of nursing. I just taped a video for you all that has already went live. I popped back in because I got notified that I need to sit in on a deposition at a facility that I formerly worked at. As a nurse, I have never been involved in a deposition where I was directly involved as a healthcare provider. However, many times as a nursing supervisor, a nurse manager, and an assistant director of nursing, I have been deposed on several cases, okay? We need to talk about the top reasons that nurses are becoming involved in lawsuits and nurses are going to jail, okay? Very serious topic. We need to know how to keep our licenses. I always told my staff, my new nurses, my nurses students when I was a nursing instructor, that the goal is not to just keep the license, not to just get the license, but keep the license. That's the ultimate goal. Almost like everybody want to get married, everybody want to get to the altar, everybody want to get to the ring. It's easy to get married. It's very difficult to stay married. So we don't just want to get our nursing licenses. We go through hell and hot water to obtain them, but we want to keep them. I know you all have been seeing it in the news that nurses are being sued. Nurses are going to jail. And for some reason, everybody thinks that nothing will happen to them. So I want to share with you all the top reasons that nurses get deposed, that nurses get sued, and that nurses are being put in jail doing jail time, okay? The number one reason I have been deposed, I have sat in and been questioned about incidents and accidents that have happened at facilities that I've worked at, is a result of a patient receiving a serious injury or a death that resulted from a serious injury. And in most cases, those are falls, okay? We cannot prevent all falls, but in a lot of cases, a lot of falls and injury happens as a result of lack of supervision. Nurses, we need to be aware that we are being sued. Our licenses are being taken. Our licenses are being suspended, okay? Our licenses are being revoked. Nurses are going to jail. This is a very serious topic. Somebody got to discuss it with you all. The next one is neglect. I know a nurse right now that's involved in a neglect case that's involving very basic ADL care, very basic ADL care. People are taking this to court. They're putting their loved ones in our care, and we should be providing at minimal very basic ADL and grooming care. Their areas that they're living and staying in should be kept neat and clean. People may not want to hear, but I'm going to sip the tea, I'm going to spill the tea, and I'm going to tell y'all that it has to happen. We have to make sure that we, as well as our nursing assistants, those duties and responsibilities that they have, that they are performing those duties. Improper lack of basic hygiene toileting. This patient, a part of her lawsuit that I know the nurse that is being involved in right now is she was denied toileting. We cannot just put adult briefs on patients when they are continent, okay? That's a huge part of the lawsuit, okay? It's not something to snicker at. This is serious, okay? The next thing that I have set in and been questioned about that nurses have been pulled in to depositions about, they are involved currently active lawsuits, okay, is about delay in treatment, especially when a patient has had a change in condition. We cannot just afford to pull everything over to the next shift, hand it over to somebody else and get somebody else to do it. In the last video that I just did, I talked about the importance of knowing when to call the doctor. When your patient is having a change in condition, that is one of the reasons that you need to call the doctor, okay? A change in condition and a delay in that treatment. They consider it a delay in the treatment because if it's not communicated to the physician, then the patient's care is delayed. Pressure ulcers. Pressure ulcers. Many nurses get caught up in lawsuits regarding pressure ulcers, the development of pressure ulcers under our care. I know we're busy nurses. I'm just delivering the information, okay? Medication errors. Just in the news, we know it was a huge case just in the news where a nurse made a mistake and gave a patient the wrong medication. And as a result of that patient receiving the wrong medication, okay, that patient lost their life. Medication areas, we got to follow our 5 rights. In some cases, there are 6 rights. In some cases, there are 7. Whatever the facility, the hospital, wherever you're working at, know those rights that they want you to follow, okay? We have to be following the rights when we are administering medication. Administering the wrong medication can cost a person their life, okay? Choking incidents. Choking. A lot of times, patients choked as a result of receiving the wrong diet. It's got to be said. As a result of receiving the wrong diet. Everybody knew the patient was mechanical soft. Somebody gave him regular. It's got to be said. Infections. Infections is a main lawsuit that nurses are getting caught up in because especially our elderly population, and it's not always our elderly population, but when patients acquire infections under our care, a lot of times and in many cases in our elderly population, when they trace that back to a patient's death, days, weeks, and months later. Okay, nurses, I just wanted to come in. I know the nurse personally, a really great person that I will be being disposed about. Disposed, I don't know why my words are not coming right. All right, today I'm really heavy-hearted in regards to this particular nurse being pulled into this particular lawsuit right here, because they're not just suing the facility, they are suing individual nurses as well. Okay, so I just really wanted to pop back in and discuss this topic. We need to be more conscious on the reasons and ways that we can lose our licenses. Okay, this is very serious. And I'll also add, as a nurse manager, assistant director of nursing, when we are brought in to a deposition, when we are questioned, they want to know what you know in regards to things like this, the way the facility has educated you, or if things are basic nursing and basic skills that we have acquired in nursing school. So I just wanted to add that Not want to make this a long drawn out video, but I do want to make you all aware that it is very important that as we go through our busy days as nurses, that we are being as cautious and as careful as possible to do everything that we can in our power to make sure that the patients that are entrusted to us and with us receive the best care possible. As always, like, comment, and subscribe for more content just like this. I'm going to be spilling and bringing all of the tea on, everything that we need to know, all nursing.